FNP 652 Midterm Exam Newest 2026-2027 Actual Exam with complete questions and correct detailed answers verified answers. Question 1. PG1. FNP 652 Midterm Exam Newest 2026-2027. Actual exam with complete questions and correct detailed answers, verified answers, already graded A+. What are the normal, borderline and positive results ranges for sweat chloride parameters for cystic fibrosis? Normal, 40. Borderline, greater than 40, 60, do a retest. Positive CF, greater than 60. Normal, 40. Borderline, greater than 40, 60, do a retest. Positive CF, greater than 60. Question 2. In a patient with known cystic fibrosis, what PFT results would you expect to be demonstrated? Airway obstruction. Airway obstruction. Question 3. In a neonate with a meconium ileus, what test should be run to rule out CF, pancreatic enzyme, immunoreactive trypsinogen? Pancreatic enzyme, immunoreactive trypsinogen. Question 4. A 4-year-old patient presents to the clinic with his father who is describing a recent onset of nighttime barking cough with periodic stridor and a low-grade fever. What condition do you suspect? Croup. Croup. Question 5. What is the most common cause of croup? Parainfluenza. Parainfluenza. Question 6. PG2. What medication would you prescribe for a 4-year-old male with a diagnosis of croup? Dexamethasone. Dexamethasone. Question 7. What is the most common cause of bronchiolitis? RSV. RSV. Question 8. What medication should be given during RSV season to premature infants born before 29 weeks, cyanotic congenital heart diseases, chronic lung disease or neuromuscular disorder patients? Palivizumab. Palivizumab. Question 9. What medications should be avoided in cases of bronchiolitis? Nebulizers/racemic epinephrine/hypertonic saline/systemic corticosteroids. Nebulizers/racemic epinephrine/hypertonic saline/systemic corticosteroids. Question 10. Condition associated with reversible airway obstruction, inflammation, and increased bronchial hyperresponsiveness. Asthma. Asthma. Question 11. What is the asthma allergic march? Family history, food, allergies, atopic dermatitis. Family history, food, allergies, atopic dermatitis. Question 12. What is the step 1 medication for asthma? Inhaled SABA. Inhaled SABA. Question 13. What is step 2 in asthma medication? Inhaled SABA and add low-dose inhaled corticosteroid, ICS. Inhaled SABA and add low-dose inhaled corticosteroid, ICS. Question 14. PG3. What is step 3 in asthma medication? Inhaled SABA and moderate dose ICS, or keep the low dose ICS and add LABA. Inhaled SABA and moderate dose ICS, or keep the low dose ICS and add LABA. Question 15. What is step 4 in asthma medications? Inhaled SABA, moderate dose ICS and LABA. Inhaled SABA, moderate dose ICS and LABA. Question 16. What is step 5 in asthma medications? SABA, high dose, ICS, LABA. SABA, high dose, ICS, LABA. Question 17. What is step 6 in asthma medications? SABA, high dose, ICS, LABA, and oral systemic corticosteroids. SABA, high dose, ICS, LABA, and oral systemic corticosteroids. Question 18. What are 4 examples of a SABA? 1 albuterol, 2 levalbuterol, 3 Preventil, 4 terbutaline. 1 albuterol, 2 levalbuterol, 3 Preventil, 4 terbutaline. Question 19. What are 3 examples of ICS? 1 Asmacort, 2 Flovent, 3 Pulmicort. 1 Asmacort, 2 Flovent, 3 Pulmicort. Question 20. What are 4 examples of a LABA? 1 Salmeterol, 1 Salmeterol. Question 21. PG4, 2 Formoterol, 3 Advair, 4 Symbicort. What class of medications is ipratropium bromide, Atrovent? Anticholinergic. Anticholinergic. Question 22. What constitutes intermittent asthma? Occasional exacerbations that happen less than 2x per week. Occasional exacerbations that happen less than 2x per week. Question 23. What constitutes persistent asthma? Frequent exacerbations, greater than 2x per week, but not daily. Frequent exacerbations, greater than 2x per week, but not daily. Question 24. What constitutes moderate asthma? Daily symptoms with daily SABA use. Daily symptoms with daily SABA use. Question 25. What constitutes severe asthma? Continuous symptoms and frequent exacerbations. Continuous symptoms and frequent exacerbations. Question 26. You should avoid more than how many uses per day of an inhaled beta agonist? Avoid more than 4x per day. Avoid more than 4x per day. Question 27. What is the most effective type of medication for long-term control of asthma? Inhaled corticosteroids. Inhaled corticosteroids.